Ano ba ito exactly, ano itong cardiomegaly na sinasabi ng enlargement of the heart, 'di ba? At paano to naiiba doon sa kasi kanina I read na hindi ito sakit, hindi siya disease, it's a condition.
Yes.
What is it? And what brings it on?
Okay. So pag sinabing cardiomegaly, ito ay abnormal na paglaki ng puso dahil sa pagkapal o kaya pag-stretch ng puso. It is not a disease, it is only a sign of a disease. Okay? So when it comes to other heart problems, it is already specific heart problems. So, when we say kasi disease, we have signs and symptoms. So, cardiomegaly is only a sign of a specific heart problem.
So, are you born with that? Is it inborn? You acquire it? How does one get an enlarged heart?
Okay, so we have causes of cardiomegaly, some acquired, some inherited. So, hypertension.
Presyon, ayan.
Yes, pag matataas po. Pag chronic hypertension, kumakapal yung muscle ng heart, so lumalaki po yung heart. And then we have ischemic heart disease. Ito po yung mga bara sa ugat ng puso.
Ano yung bara-bara ba yan? Yung mga taba ba yan? Yung makinain mo, cholesterol, ganyan?
Yes po. Yes.
So, kumikitid yung, kung may ugat ka, kung tubo yung ugat mo, dahil maraming mga nakabarad doon ng mga taba-taba at kolesterol, kumikitid yung dadaluyan.
Yes po.
Ganun yung physiology. Tapos ngayon, yung heart mo ngayon, being a pump, hirap na pump, kaya lumalaki.
Yes po, opo. So, tama po kayo. So, tubo yung coronary artery which supplies blood to the heart.
Yeah.
So, as we grow older, we eat high-fat diet. So, pabara, pakipot ng kipot. And then, mahihirapan na po yung heart natin. Then, we can have heart attack.
Ayun. So, yung sabi natin enlarged heart, meron bang sign ba yan? How does one measure the heart? How do you go about, ano ba yung ideal size? Is that measured or paano ba? They were saying before, your fist, that should be ideal? O,
kung gaano kalaki yung kamao mo, ganun din kalaki yung puso mo.
Ganun ba yun, doktora? Okay. Factor fiction.
So, in adult populations, we have a rough estimate of the size of the heart. So, clenched fist or yung kamao natin, tama ka, Miss Pat. So, pag nag-clenched fist ka, roughly, this is the estimate of your heart.
Okay, oo. So, pag enlarged, malalaman lang ang enlarged pag ikaw ay nagpa-x-ray?
Nagpa-test.
Nagpa-test.
O, isa na po doon ang x-ray.
Okay. So how does what is the normal usually you mentioned nga aside from hypertension, genetics rin ho ba, are there any other reasons why somebody gets an enlarged heart?
You can be born with it.
But or acquire.
Okay. Acquired through drug abuse.
Talaga?
Yes, opo.
Ano yan?
Anong illegal drugs?
Illegal drugs or yung mga drugs?
Cocaine, shabu.
Hindi naman yung mga medication.
Yes, some medications like antibiotics.
Okay. Prolonged use.
Yes, prolonged use and abnormal dosage of the
overdose.
medicine.
Oo.
Tapos, minsan kasi parang I read na pag pwedeng short term, pag buntis, ganyan ba? Merong short term na enlarged heart?
Yes po, because of the severe stress of the pregnancy. So, we call it postpartum cardiomyopathy.
And then,
So, stress brings it on?
Yes.
Stress
yes,
Na para
po.
mag-enlarge yung
Yes po, Miss
heart.
Ali.
Paano mai-stress yung puso mo?
Because of the chemicals that our body produces, so the heart will be stretched. And then, hirap na po siya mag-pump. Then you can have cardiomyopathy, which will lead to heart failure.
Kasi the heart is a muscle No?
Yes po,
It's a muscle.
pure muscle.
Pure muscle siya na pag bomba siya ng bomba para yung dugo patuloy na
To circulate.
the
blood
from head
around
to
your
toe.
body. So when do you start suspecting if you have an enlarged heart? Dahil ba
symptoms?
malaki ba yung puso, hirap ka ng huminga, ganun ba yun? Or kapos ka sa hininga? Or masyadong mabilis naman yung heartbeat mo? When should we see you? When should we see a cardiologist to verify if we have an enlarged heart?
Okay, so we have symptoms of cardiomegaly. One will be easy fatigability, shortness of breath, palpitations, then you have edema. So yung ibang pasyente po, lumalaki yung paa. Opo, lumalaki yung paa.
Ano yung namamanas?
Namamanas, yes. So, because of the excessive water sa body, paakyat na po ng paakyat yan. From paa, legs, until pwedeng abdomen or pwedeng buong katawan na po pag napabayaan.
Yung tubig.
Yes
Pag
po.
nagmanas ka ba, kasi essentially parang pag nagmamanas ka, parang talaga may problema sa circulation mo, di ba? Pag nagmanas ka, ganun ba
Not
yun?
necessarily po.
Oh, but how would you know na yung pagmamanas mo is related to an enlarged heart?
Okay, so we need to do tests.
Ayun.
And-
So,
and-
kumbaga, magsuspecha ka na.
Yes po.
Shortness of breath, fatigue, yan yung mga yung
Palpitations.
mga palpitations, yun yung mga pangunahin. And then,
Parang hindi po yung, excuse me lang, Pat, kasi isa sa mga pinapayo, drink more water. Stay hydrated, pero at the same time, mamamanas ka naman.
Yes, okay. So, if you don't have heart failure, water is good. You hydrate.
Yeah.
Okay? But if you have heart failure already, limit the oral fluid intake.
parang
Yes,
dialysis
opo.
rin, no? Para pag may kidney problem
ba yun?
rin.
Yes po. Kasi po, tama po kayo, Miss Sally, yung puso natin, taga-bomba, yun lang naman po ang trabaho niya. So, lab-dab, iikot yung dugo from head to toe. So, kung mahina na po yung muscle ng heart, mahina na,
Mahihirapan.
mahina na. So, instead na mas madaming dugo ang lalabas to supply the body, mas madaming matitira. Okay, so mas madaming matitira, lalaki ang puso, and then excess water intake pa.
Oo.
Tapos hindi na makayanan ng puso, magmamanas na yung pasyente.
I did not know that. ha?
Okay. So ano yung mga pag ganyan na ano yung mga cure, remedy? What will the doctor recommend? Makukuha ba yan sa oral na gamot? Kailangan bang surgery yan? Kailangan ma-ospital? Paano
Ang treatment.
pinapaliit? Paano pinapa-back to normal yung ating puso?
Okay.
Meron ba?
So, it always depends on the etiology of the cardiomegaly. We have medicines, then we have device implants like
oo.
ICD.
Oh, what is an ICD?
It is a device that we put inside the heart. Pag may nakakamatay na electricity, it will shock the patient. So, it will save the patient from dying.
You put that permanent na? It's a permanent
Yes po.
apparatus inside your body? ICD?
It sends
ICD.
an electric current.
Yes po. So, di ba sa mga airport may mga
Scanner.
AED doon? Opo.
yung
pang-shock.
tinatapat sa bag mo? Hindi.
Hindi.
Hindi po.
Yung aparato sa wall.
Yes po, opo.
Parang clear!
Yes, then
Yun?
you shock the patient.
Ayun.
Okay, so if you have heart failure, risk of VTAC, ventricular fibrillation, that can cause death. So what we do is to put ICD in the heart so that kapag nagkaroon ng VTAC or VFib ang pasyente, you don't have kasi enough time to get the machine and shock the patient because every second it counts already. So the ICD will shock the patient. So it will save the patient from dying.
implant ba yun?
Yes
For
po.
life, you will keep that there?
Yes.
Let's get together. Sa NET25. Sa NET25.